So, what are the key things to know about preparing an advance directive? Do make sure advance care plans are legally recognized. Ask a lawyer for assistance in completing advance care planning. Advance directive law varies a bit from state to state. Do remember, though, that lawyers are not medical experts. Healthcare providers supply valuable assistance in completing advance care planning. They can describe common treatments and their likely outcomes for a person in the patient's condition and with his or her family history. Don't think of advanced care planning as a way for institutions to limit access to care. It's a myth that advanced care plans are a mechanism for rationing care or denying treatment to older persons. Many people who complete advanced care plans do want limited treatment, but not all. And Medicare and Medicaid are fiscally able to fulfill the preferences of every patient. Do revisit and revise plans every few years. Different medical treatments become available, and a patient's health status changes. He or she may develop new preferences about types of care. Don't put advance directives in a safe deposit box. No one can act on wishes that are locked away. Loved ones and physicians should have copies handy in case of a medical emergency, and advance directives should be included in personal medical records. Don't make the mistake of thinking it's too early to plan. Emergencies happen, even to healthy young people. Do think carefully about wishes and explain them clearly and in detail. Guides like 5 Wishes, the Conversation Starter Kit, and the Good to Go Toolkit are free guides developed by professionals that explain medical terms in simple language and suggest areas for thought. Terms like heroic intervention have no clear medical meaning. Instead, think about quality of life, the type and severity of symptoms, and the invasiveness of treatment. Do open up the conversation. Ask family members what kinds of care they would want in their final days. Don't assume that loved ones already know how a patient would want to be cared for at the end of your life. Often they do not. The closer they are to the patient, the less likely they are to be able to separate their own wishes from the patient's. Do learn about palliative care, also called comfort care. The aim of palliative care is to alleviate distressing symptoms such as anxiety, dry mouth, constipation, shortness of breath, nausea, and pain. Patients can receive palliative care at the same time that they pursue treatments aimed at curing illness. Don't make the mistake of assuming that palliative care and hospice are identical. Both do have the goal of symptom alleviation. Hospice is palliative care for persons who have a prognosis of less than 6 months to live and who have agreed to forego treatments designed to sustain life or cure illness. Hospice can take place in a variety of settings, ranging from the hospital to the patient's own home. It incorporates psychological or spiritual care to help a dying person and their survivors to prepare and cope with loss. Do think about advanced care planning as a positive thing a person can do to prevent nasty outcomes later. In this respect, advanced care planning is not so very different from getting a flu shot each fall or visiting the dentist every 6 months. Don't wait until it's too late. Half of ovarian cancer patients don't have an end-of-life discussion with their doctor until a month before death. That's too late to experience all the benefits of advanced care planning.